Hi, Miss Grider. How are you?
Dr. Didi.
Hi, it's so nice to meet you. Welcome to our clinic today.
Thank you.
I want to say doing residency is tough. It's not easy. It's a lot of hours. It's high stress. Here in Selma, I believe it's unique because we're the only residents here. What's great about that and unique about that is that no matter what's happening anywhere in the hospital, in the clinic, in the nursing home, we are the providers.
Push down against my hands. Perfect. Take these legs, push up.
Dr. Didi Baker was a medical resident at the University of Alabama Family Residency Program in Selma, Alabama, one of the few programs in the country where residents train entirely in a rural community. She finished the program in the spring of 2023.
The learning is so intricate because there's nobody else fighting for that space. So what's beautiful about that is if there was procedures, we were called, if there was anything in clinic that we need to do, we come together and say, hey, how do you do this? And, we help each other out. Those types of things are second to none.
Hey,
Hey,
you ready to check out?
I am. My next patient is here for just routine follow-up.
Dr. Tiffany Maycock is the director of the program.
Because the needs in rural areas are unique, the difficulty of transportation and things like that, and a lot of times patients will wait a long time before they see the physician, then they'll be a lot sicker when they come in to see us. So it's really important to train rural physicians to be able to meet those needs.
Hopefully, as we continue to maximize the Ozempic, she's going to see improvement.
Rural physicians often have to be able to take care of patients in a wide variety of arenas that often have to do hospital care and acute care and chronic care. Being able to train physicians in a way that they are comfortable taking care of patients in that same environment is really crucial. We do a lot of simulation training, and so these are our simulation mannequins where
Rural residency programs like the one in Selma were created to address the shortage of doctors in rural areas. Several challenges, particularly with funding, have limited their growth, but studies show they are effective. About 70% of the doctors trained in these programs will eventually practice medicine in rural places. They are also more likely to stay in rural communities longer than non-rural graduates, according to a 2020 study. Dr. Randy Longenecker is one of the co-authors of the study and was also the director of a rural residency program in Ohio for 15 years.
A rural background student is about 2.5 times as likely to go into rural practice as an urban background student. The most likely person to go into rural practice is a rural student who also does residency in a rural place. So regardless, rural or urban background, place of residency training is the most important factor.
So our residency program was started in 1978 by Dr. Donald Overstreet, and so our first graduate was here in 1979.
Most graduates of the UAB Selma residency program end up staying in the South. About a third of those will stay in Alabama.
during my tenure, there about 50% of our graduates have stayed in Alabama, which I think is awesome. And I've had about 4 residents actually stay in Selma.
One of those graduates who stayed in Selma is Dr. Olusunmisola Oyesiku. She's now a primary care provider at the Rural Health Medical Program, a federally qualified healthcare center that provides low-cost medical care, regardless of the patient's insurance status.
Well, you're doing okay. I'm just going to go to the side and check. I'm missing a little bit for your heart, all right? Okay.
And just as she was trained to do, Olusunmisola performs many roles in her community.
So in addition to being a primary care doctor, I'm also a women's health specialist.
It's possible for a woman within that postpartum period to still have a seizure.
But with the Rural Health Organization, I also work as the Chief Medical Officer Assistant. And most importantly, I also get involved in a lot of community outreach. We're making sure that we're reaching other members of the community that could not afford to come to clinic or don't have a means of transportation to come to the clinic.
Selma sprang overnight from an obscure southern town to the front pages of world newspapers. This church was headquarters in the Negro drive for the right to vote, and it was here that Martin Luther King came to lend his support to the campaign. He pointed out that from
Selma was a pivotal location in the fight for civil rights in the 1960s. As a new resident, Olusunmisola recalls being immediately immersed in the town's rich history.
We first had to learn the culture, learn the history of Selma, learn the people of Selma. Typically in our first orientation, we would go around and drive around Selma town and learn about the historical locations. And we worked in the hospital at Vaughan Regional Medical Center. As residents, we did our inpatient hospital rotation there. We worked with the cardiologist, the OBGYN, the pediatrician, and the orthopedic surgery. We were spread across all the subspecialties, which is what that kind of residency does. It molds you, gives you that all-around exposure to rural medicine.
While many doctors were trained in rural areas before then, the first official rural training track was established by Family Medicine Spokane in the mid-1980s. Only 2% of residency training takes place in these types of programs. In 2023, there were over 160 accredited rural residency programs in the US. Most of these are programs in family medicine, which rural patients rely on the most. With rural areas facing physician shortages and poorer health outcomes, there is a great need for doctors in these regions. But the fact remains that the majority of doctors still train in urban areas. One of the greatest barriers to expanding rural residency programs is funding. Most of the funding for medical residencies still go to urban hospitals. These funds are largely provided by Medicare and Medicaid, which spend billions of dollars annually. According to a 2018 study by the U.S. Government Accountability Office, only about 1% of these government funds went directly to a rural facility.
It's a very urban-centric system. There's great disparity in how much funding residency programs get.
While there are exceptions, federal funding for medical residencies are given to hospitals, not to the programs directly, which makes it more difficult for smaller rural facilities to access funds for training new doctors.
What has happened in some places is that rural hospitals, for example, have closed. And now rural patients go to urban hospitals for care. And if an urban hospital takes care of enough rural patients, they're considered a rural hospital. And as urban hospitals have bought rural hospitals and closed them, more and more patients are being referred to the urban place. And so the urban place meets the criteria for a rural referral center. And if they meet the criteria for a rural referral center, then some of the funding that goes for graduate medical education can go to the urban hospital as if it were rural.
The main thing is when they talk about being diabetic, we want to make sure that we are assessing your risk of having, it increases your risk if it's combined with hypertension and high cholesterol.
In an effort to increase the number of rural physicians, the federal government has also released millions of dollars in funding to expand rural residency programs across the country. Between 2019 and 2022, the Health Resources and Services Administration gave out over $43 million to grow graduate medical education in rural areas. In 2023, the Department of Health and Human Services gave another $11 million to 15 awardees to establish new rural residency programs. While these funding streams are promising, recent studies show that rural-based programs still face an uphill battle when securing funding. For example, in 2021, the Centers for Medicare and Medicaid Services announced 1,000 new residency slots aimed at increasing the number of doctors in medically underserved areas, especially in rural communities. But when the first run of recipients were announced in 2023, only 5% of these programs were located in rural areas. Most of the slots went to medically underserved urban areas.
Those of us who are actively involved in training physicians for rural practice believe that if our system for funding graduate medical education was more connected to the place where the doctors are needed and train them there, that would be a good thing. So I refer to it as a place-based policy where the money would go to places rather than to hospitals, and it would go to programs.
So we recommend that your blood pressure should be within a certain range. When it's that high, is very high, it could cause a stroke or a heart attack.
Originally, no, I did not plan to practice in a rural area, but there was something about my residency training that exposed me to rural medicine that just made me fall in love with this kind of practice. It was my training in Selma that exposed me, and not only exposed, but enlightened me about rural medicine and caring for the underserved and the uninsured and the people that, and it's not just about those that need your help, but being in a position where you can actually influence and impact change. I thank God that I did choose this specialty, and that diversity of care tells me that I'm probably going to be in it for a long period of time and might not change anytime soon.